Real quickly, it's an honor to be here. Really love this conference. I came to it a couple years ago in the spring, and it tends to overlap with the Skoll conference in Oxford, so I haven't been back, unfortunately. But it's a real pleasure to be back today. Social entrepreneur, Water for People has been labeled an entrepreneurial, social entrepreneurial organization, and that's pretty cool. I think we are sitting back, though, and starting to say, getting involved in a bigger conversation that's happening that's really starting to say, where's the bang, right? So there's a lot of promise around social entrepreneurism. There's an enormous amount of rhetoric. But where's the bang? Where's the transformative, systematic change that this genre or this kind of group seems to promise but is struggling to deliver? So what I thought I'd do today is talk a little bit about what we're trying to do, kind of localize it in our organization, try to tell you what we're attempting to do in terms of systems change and some of the struggles we're having with that, and look at kind of three things. One, external factor that's challenging. One internal challenge that is extremely difficult. And then something we're trying to blow up to help us move along, because entrepreneurs like to blow things up. So we might as well blow up something. So let me step back a little bit. Water for People is made up of Africans, Asians, Latin Americans, and people from North America and Europe who have worked in water and sanitation for a long time and are actually sick of the way the sector operates. And the way the sector operates is very simple. I knew this girl in Zimbabwe. I lived in Zimbabwe for quite a while, and I'm one of those weird guys who kind of hangs out at water points in the morning, and moms and girls kind of feel this is a bit weird, but over time they get comfortable with it, and I get to talk to them. And so I used to hang out at this one water point in rural Zimbabwe quite a bit, and I met this woman named Fanta. She really was Fanta, and I asked her, which Fanta are you? And she's Fanta Orange. That was her mom's favorite drink. She got a big bottle of it every birthday, and she named her first daughter after that. She was a sweet girl. She was about 13. And you actually know Fanta. You know her. If you know anything about water, you know her. She's that girl that everybody in the water sector talks about. She's got kind of ratty clothes. She's wearing sandals that kind of are broken. She's carrying a big bucket. She walks through the bush. She gets to this muddy puddle. She digs down. She scoops out water that we're all kind of disgusted by. She bounces it on her head, and she walks back, and she misses school, and her life is ruined, and all of that. It's actually true. It's actually true. But the sad thing is, when I was walking with Fana, we took a break. We're walking along, and I'm talking to her, and she's, you know, she had big dreams, and they were falling away because she really wasn't in school. And we took a break at a broken hand pump that had been put in 2 years earlier by a really well-meaning organization that took her picture, told her story, told how this investment was going to change her life, and went back to donors, submitted reports, submitted financials, submitted the pictures, and moved on. And for a while, this village in rural Zimbabwe was pretty excited. They actually had a water point. It was good water, but it broke. Systems weren't in place to keep it going. And Fanta was right back in the water, in the polluted water that she was supposed to be out of because of the reports that had been submitted. Now, that story is repeated all over Africa, Asia, and Latin America. We now know how big the problem is. We know that between 40 and 60% of water points are broken at any one time in Africa, in Asia, and in Latin America. We know that through GPS mapping. We know that through better information coming from the field. We also know that there's very little sign that investments made in water and sanitation have lasted for a long period of time. So they tend to break down over time. They never get replaced. Communities never kind of escape the water poverty that we're all talking about. So Water for People basically said, we could do this forever. We could really do it well. We could do projects. We could tell people it's going well. We could raise lots of money, but we know it's not working, so let's pivot. What if we decided to do something totally different and focused instead on inputs, number of wells we built, number of beneficiaries we have, number of girls that we've saved, all that kind of stuff with an installation? What if we tried to imagine what the end state looks like and try to get there? try to get there. So we developed a program called Everyone Forever. It's very simple. It's got 5 principles, and it's all outcome-based as opposed to income-based, input-based. The first principle is, and it draws from, let me just say this, it draws from polio and smallpox. Those are 2 huge influencers on us. So the first principle is every family, every school, and every clinic in a district gets covered with water and sanitation. Okay, so districts like a county in the United States, it's a large geographic unit covered by a local government, lots and lots of villages, right? So we're not going to pick one village, maybe another village, and kind of move on. We have to work in this area till every family, every school, and every clinic gets access to water and sanitation. So how do we do that? We basically work at district level with local government and with local private sector and local communities, and we basically chart out year 1 we're going to implement here, year 2 we're going to implement here, year 3 we're going to implement here, and we try to saturate the district with water and sanitation services, and we do it in a way that we're asking, is this going to last for a longer period of time, which I'll get to. But basically the outcome is clear. The outcome is clear, is that every family, every school, and every clinic gets water and sanitation, and that means the woman on top of the hill, the community that's an opposition district, the family that maybe has a woman in a wheelchair, the AIDS orphaned kids, everyone has to have access to whatever the government standard is or higher. Okay, so it's easy to look at. Second outcome is that everybody pays. We really got this from smallpox. At the end of the day, there is enough money for water and sanitation in countries if we can free it. Every country has a budget for water and sanitation, and very few countries actually use it. I lived in Mozambique for 7 years, and Mozambique never spent more than 25% of the money it actually had for water and sanitation. India, 2 years ago, left $2 billion on the table. $2 billion. So there's money. The problem is that the Ministry of Finance has this mandate to decentralize funds to district level. They look across the district government landscape and they say, I wouldn't give you a dime. Bad systems, don't have proper people in place, procurement's not clear, and so they hold it. And so the power is not with the Ministry of Health, it's not with the Ministry of Water, it's not with the Ministry of Public Works, it's with the Ministry of Finance. That's where the decisions are made and that's where the money moves. And so what we've done is we've spent an enormous amount of time with the Ministry of Finance at national level and district departments of finance, and we've cleaned up that route of funding so that money can start to move. When we start and we basically say, we're gonna create a situation where you're actually accessing this money and investing in water and sanitation, so it's auditing, it's accounting, it's reporting, it's procurements, it's tendering, it's all that stuff that isn't a project, that's pretty boring, but is actually pretty important. And we're going to put some money into it. We'll have some skin in the game, but we want to see our financial footprint go down, and we're going to say to communities, you need to pay too. So communities around the world, rich, poor, middle, doesn't matter, have to put some money in because at some point they're going to have to pay for their water services. And so what we've seen all over the world, we do this program, Everyone Forever, in 30 districts around the world, and what we've seen is outside of Malawi and a couple other countries, our financial footprint is actually going down as government is actually drawing more money from the Ministry of Finance, not only for water and sanitation investments, but frankly for health, for education, for roads, bridges, all that. Why? Because the Ministry of Finance, again, is looking across the country and they're saying, I don't trust any of these guys except that district and that district and that district. So it's a good outcome. So every family, every school, and every clinic gets water and sanitation over time through district-based planning. Everybody pays, so they have some skin in the game. Third result is that we have to work in a way that these districts never need another international water and sanitation NGO ever again. That's the point of philanthropy. That's what the outcome should be, and so hold us to that. So what that means is our staff spend an enormous amount of time working with local partners in finance. The two big problems we have are finance. So how do you generate enough money locally from tariffs, taxes, and transfers to replace systems over time, to keep systems operational, to keep water flowing without external support? Huge one. And the second biggest problem we have is declining and deteriorating water sources. So at the end of the day, I don't really care what people think about climate change. I happen to think it's a real issue. But we know that water resources are not replenishing the way they used to, that water quality is going down and water quantities are going down. And we have to address that for future populations so that agriculture, tourism, communities, business, all of that can cooperate around water resources and not compete. The other challenge we have is as systems, as communities grow and change, systems have to grow with them. So every family, every school, and every clinic, everyone pays, NGO independent. Those are the three outcomes. The fourth outcome is we are not going to be the kind of organization, if we're serious about kind of catalytic change and systems change, then we have to make this so compelling that we're not bouncing around to every district in the country because then we're too involved. We have to make it so compelling that other districts say, ooh, I get that, I want to do that too. And then they start to do it. Other organizations start to help them, the ministries at national level start to help, so that this modeling that we're doing at district level starts to take off. Now when we set that goal and that outcome, our staff said, no way. That is never going to happen. It's just impossible. Actually, it's been the easiest part of this program because we've learned a really interesting thing. Mayors of districts brag. They brag a lot, and they have huge ambitions. So when I started in 1987 in Africa, district commissioners, mayors, all of that, basically got into government to feed on the state. They basically were going in. It was a way to get money, maybe move up through the party, but it was really kind of a messy, let's just call it a very messy situation. A lot of talk around democratization around the world. There's a lot of focus on national elections. Those are interesting. I am actually much more interested in local elections. And local elections have changed politics at local level in my experience. We are seeing over and over again that mayors are coming in with ambition to go up the line, ambition for higher office, but if they do not deliver something, they're gone. They get kicked out. It's actually fascinating. So we've had this situation where mayors have latched on to everyone forever. They're seeing it as a major delivery, and so they're bragging about that to other mayors. But the biggest thing they're bragging about, which is turning the heads of other mayors, is they're bragging that they're getting money from the Ministry of Finance. Cool. That's really cool. So when we started this program, we work in Latin America, Africa, and India. Very different hydrologies, very different cultures, very different economies, very different challenges, very different governments, all that kind of stuff. But we're starting to see a common pattern emerge that in countries that get close to full coverage in a district, or at full coverage, it sparks this explosion across other districts. So what does that look like? In Bolivia, we started in 6 districts. Bolivian districts are fairly small, communities dispersed, very expensive schemes, very small populations, have to think about money in a different way because there's no way communities will collect enough money to replace the systems that are in place, and there's actually not much alternative to the systems because communities and water sources are very far apart, so it's a lot of transmission lines and things like that. Of the 6 districts, 1 district reached full coverage, and it was an opposition district. It was fabulous, fabulous. So national government was outraged by this. And so they sent a team in to check if in fact it had happened. They went from door to door, every house, and they came out and they said, actually it's true. They've got full coverage. And so the other mayors are like, there is no way we're letting an opposition district be the story of water and sanitation in our country. So it spurred this enormous explosion of interest. We just signed an MOU with 20 other districts to provide Everyone Forever support. We will show them how we did this. So we'll show them that. But they're paying 100% of the costs. We're not paying a dime. That's great. That's what smallpox did. That's really what smallpox did, which was great. In Honduras, we started in 4 districts. Again, sort of same story. 1 district got to full coverage. We now have worked with the national government, 7 other NGOs, international NGOs, and other local role players. And there's now a plan to roll Everyone Forever out to 1/3 of the country and then nationally, which is exactly what we should be doing. We should be catalyzing that change. In Rwanda, same thing. We're working in 2 districts. One is actually quite far away from full coverage, but the process has become so clear and the mayor so compelling that there's now a strategy in place to roll it out to the other 17 districts in the country. Rwanda wants to be the first country in Africa at full coverage. And then in the state of Bihar in India, which is remarkable, if anyone knows anything about India, Bihar is a really tough place to work. We're driving towards full coverage with the local government in 1 district. We're now leading a 7-ministerial panel to get Bihar to be the first state in India at full water and sanitation coverage and NGO independent. So, every family, every school, every clinic, everybody pays, NGO independent, and it replicates without us. It's modeled and grows. Last thing we did was we basically said, we're going to monitor the hell out of this. That's the way this is going to work. So what we did is we developed a program that said once a district gets to full coverage, so we monitor throughout, but when it gets to full coverage is day 1 of a 10-year monitoring commitment we have made, where we will go and monitor results. And the point of monitoring is not to sit back and go, woo, we are the best. That's not what it is. Our monitoring program is really around what is going well, what are the strengths of the program that we can build on, what is so bad we kind of, oh my Lord, got to change that dramatically, and what are we going to do about those challenges, and creating an environment and holding the space, and I'll talk about that a little bit later, holding the space for governments, local private sector, other sector role players to get comfortable with bad news and get inspired by not only kind of hearing the bad news, but kind of unleashing our problem-solving ability to address those problems. And that's really where a lot of the innovation is coming from. The innovation is not coming from kind of crazy things outside or new products or anything like that. It's coming from holding the space, letting people ask hard questions, and trying to pivot to solve those problems. And so what we're seeing is improvement in work, real challenges coming up, new things coming in to address those particular problems. That's what we're trying to do. We're trying to model this and make it really compelling and to get it to take off. So Water for People faces a couple of challenges with this program that are interesting. I think that are interesting for the purposes of this conference, and maybe during questions you guys can help me out a little bit. So the first problem is external to us, and it's something we're trying to navigate. So the philanthropic landscape is changing dramatically, right? Thank God, because the philanthropic landscape is a disgrace, actually. It's changing, and people are starting to get the idea that their philanthropic investments need to lead to better outcomes, and they're starting to get the sense that it's a messy, non-linear road, right? So you've heard the CEO of Rockefeller Foundation, you've heard Howard Buffett, you've heard a lot of the big hitters stand up and say, corporations as well, stand up and say, we need to accept more risk, we need to be bolder, we need to realize this is not going to be easy, and we need to start buying outcomes. That's basically what they're saying across companies and foundations. And we say, spectacular. Let's do it. And nothing really happens. So we have a real problem that there is a gap in the funding environment between ambition and action. And I think that's okay. I think that's okay for now, because I think the leadership of these agencies are talking about this in the right way. They're talking about shifting. What they haven't done, I would offer to them, is they have not created the space within their institutions for their program officers and the people whose kind of necks are on the line for these decisions to actually take those risks. And so what ends up happening is you have ambitional leadership in foundations and corporations, and you still have too many people who are afraid to make a move, because if it doesn't work, they're not clear that if the outcome isn't achieved, whether they are okay. or whether they're going to get their heads chopped off. I think it's actually a really serious thing. The other thing that's happening is corporations are moving much more dramatically into shared value. Shared value is basically, and there's lots of good examples, frankly, in the health and agricultural sector, way ahead of water and sanitation. But there's examples of companies who have particular products matching up with nonprofits who are providing service delivery, and together they're actually achieving a result. The one company in the water and sanitation space that really gets it, frankly, is Unilever. Unilever's way ahead on this. But again, most companies don't know how to navigate that yet, and frankly, most nonprofits don't know how to negotiate that yet. And so there's a funny dance going on where we're trying to figure out what the shared value is and how to actualize that in the field, particularly in water and sanitation. The reason why it's hard in water and sanitation is a lot of companies want to sell their equipment or use their equipment, and there are times where that's appropriate and there are times where it's actually not at all. And so we're trying to figure out how to navigate that. And again, there's a kind of a breakdown between ambition and action. So externally, the philanthropic environment is changing. They want to go towards something like everyone forever, but it's not really clear what the steps are. And what we're having a lot of discussions with donors around is love the ambition, love the results, see the results, what is my money paying for on the steps along the way. And we can answer that a bit, but again, it tends to break down when it gets into the fuzziness, frankly, around monitoring, where I don't know what the results will be, but we're creating an environment to shift, and that shift will try to address that problem, and they want to know what that shift is. But I don't know what the shift is. We're still trying. We're not even at the shift yet. We've got to figure out what's working and what's not working. So that's a real challenge. The interesting thing about the program is a lot of organizations and governments are trying to adopt this. And so the internal challenge we have, which I think is really important, is I think really good social entrepreneurs. There's a very simplistic way that I separate social entrepreneurs. And people, please criticize it, it's fine. I think that the social entrepreneurs that I gravitate towards and that I like are the ones that are not brand sensitive. They're the ones who are really focused on the outcome. They understand that contributing to that outcome, they may have a role, but they give back a lot. They debrand. They invite people in. They push and they're edgy, and they insist on really good work, but they don't hold on to their stuff. A lot of organizations hold on to their stuff. This is mine. This is my model. I hate that. I hate it when people say this is my model. This is what we do. So Everyone Forever has been doing this kind of dance where Water for People is actually quite known for debranding stuff. We developed a monitoring technology called Flow. It's really interesting. It's not that clever right now, but at the time it came out, it was pretty clever. It basically combined GPS and photography and questionnaires and analyzed it immediately and put it up on Google Maps and all that kind of stuff, and using a cell phone. We were trudging around for 10 years. We were like, oh my God, how are we going to do this for 10 years with a GPS, a Trimble GPS and a digital camera and paper using SPSS and trying to mash them together? I mean, it's messy, it's complicated. So we figured out a way to do that with a cell phone. We found quite early that the interest in this cell phone was in this app. It's kind of an app. It's not technically an app, but for the purpose of this, let's call it an app. The interest in this app was huge, and Water for People couldn't meet it. We couldn't, we have a job. It's a tool for us. We could have turned it into a business, no question. Probably would have made a lot of money. But we actually gave it to another organization called ACFO, whose mission is actually to do this, and this fit into their kind of portfolio of options. And we open sourced it, the code, so that if anybody uses the code, whatever they add to it, they have to add back. And that's been a great thing. That's been a great thing because now over 330 organizations now use Flow. 4 countries use it for all of their monitoring, and it's jumped to 4 sectors. It's in health, it's in agriculture, it's in fisheries, and it's in water and sanitation. So that's an example of the way we think. We kind of like, okay, that's a really cool thing, let's give it back. Everyone Forever is a bit like that. The branding of Everyone Forever is very generic and bland. We've now formed alliances with a range of organizations, and the battle that's going on externally and internally is quite interesting. Externally, the issue for some of the bigger NGOs who, if they came along, would actually swing this a lot faster, is that everyone forever is a water for people thing. And so we're talking to a couple of the bigger organizations, and we're basically saying, look at the evidence of flow. People used to think flow was a water for people thing. Actually, no one thinks it anymore. Just jump on, call it something else if you want, just hold the principles, and frankly, you're so big and you're so loud that people will think it's yours pretty fast. It's okay, and we're okay with that. I actually think that's really true. So in Latin America, it's been slightly modified, the name of it, to allow others to come in, and that's cool. We're now having that conversation with a number of other organizations and governments and all of that. In country, governments tend to rename it very quickly. So in Bolivia, it's called Miagua. In Malawi, it's called Water and Sanitation for All. And that's great. That's great. So we're trying to do that. The internal challenge with that is actually fascinating. It's fascinating because we have had to get staff to be comfortable with that, particularly fundraisers. That's a really hard thing, and I don't want to underestimate that in any way. It's a really hard thing from marketing and from fundraising where you want to maintain some brand equity, but you want to give back. And so what's fascinating is, frankly, we've lost a lot of people. A lot of people don't want to do that, and so they've left Water for People. And we still have people who are staying or trying to get their heads around it. And I think from a leadership point of view, the real challenge from myself and my senior management team is to continue to get people to comfortable with the idea that it's okay to give this up. It's better, and people will make it better. And our comparative advantage, if you will always be if we can kind of stay ahead and push the edges of this. But it's not about us. It's about a bigger movement. And so we have to get over that. And so that tension is really fascinating. And it gets harder as organizations grow, as you can imagine, as more and more constituents get involved. When we started this, Water for People was really small. We're now much bigger, and those dynamics are really important. I think it's something entrepreneurs have to think about as they're trying to get away from rhetoric and get to impact. Last thing, what we want to blow up, and I'm going to have to read some data. I probably should have had a slide on this. I hate slides. One of the things that's killing the nonprofit sector is the overhead debate. It's a disaster, right? Charity Navigator, I think, in history will be identified as the single biggest distorter of the market of anybody. They've not done a good job with this debate. I say that, so I did really badly on my SATs, right? Do people even take SATs anymore? Is that even possible? So I was horrible. I took it 4 times. I got the exact same score. It was really bad, under 1,000. It was horrible. So I have no right to criticize the SATs, right? I have no credibility. I think we do have credibility to kind of challenge Charity Navigator, because for 10 years, we're one of those companies that for 10 years has their 4-star approval. Woo! It doesn't mean anything. Doesn't mean anything. So what we're going to do is, and I would love feedback on this, we're going to actually try to blow it up by changing the debate. Because we think that if we can get much more catalytic in our conversations about impact, then the philanthropic market will come. So this is what we're going to do. Instead of figuring out who's admin and who's program, who's a good guy, right? Program people are good guys. Accountants and fundraisers are evil, nasty slackers. No, they are, really. They are. They're terrible people. Didn't you know that? Terrible. We're going to throw that whole discussion away. So what we did is we tested this out in Malawi, and it was really interesting. We basically said, what do we cost? Who cares? Who cares if the guy opens the door in the morning and guards our cars? Who cares if it's an engineer? Who cares? Let's put them all together, and let's not label them. Let's just say this is our investment in terms of staff. This is our investment in terms of petrol, all of our paper, all the tea that we drink when we're slacking off because we're terrible people, all the costs associated with Water for People. What did we cost? Let's put that number as one number. Don't disaggregate it. Then let's add a really big number from Denver, because we're based in Denver. We're the worst offenders of the administrative overhead nightmare, because we live in Denver, we climb mountains, we do crazy things, we shouldn't be paid. all that. So let's take 25% of our costs, which is outrageous, right? We work in 10 countries, but let's just do that because I don't want an argument on it. And then let's also do that for our regional office, which is a little better than Denver, right? You got some technical people, they live in the country. You know, there's an accountant there, not a good person, but you know what I mean. So let's take that number and figure out what that costs. No categorization, we'll take it all. And so I'm going to have to read some numbers. So that's about $800,000. That's what it costs to run our Malawi program. One of our bigger programs. It's an interesting program. It's a great program. So we're going to ask two questions. We're going to first say, what's the impact of all of our work? Good people, bad people, doesn't matter. What's the impact of that work? So what we found with our monitoring work is we break our everyone and forever into two categories. So everyone is really around service level. It's around how many people get service, how good is the service, what's the downtime, so our problems fixed really quickly and all that kind of stuff. So last year, for $800,000, we had an 18.7% increase in coverage in everyone. So that's good. That's good movement. It's really good movement. The better one for us, because we spend more time on this, is we had a 30.8% increase in forever. So in the long-term sustainability indicators. And that really came about because of a huge push around finance. So what we have is much more money moving, much more people paying, right? And so we have communities now who have gotten to the point where they can start to think about replacing their system. That's what we want. The big challenge on, no worries. The big challenge on forever is still water quantity and quality. So that's something we haven't sorted out. But we've seen huge strides. We've seen communities extend services as new people have come in. We've seen, you know, poor families, the really poor families, they've actually been able to get access to water for free, cross-subsidized by other families. So over 30% increase in sustainability indicators, over 18% increase in coverage indicators. That's pretty good. So we're getting closer to full coverage in these districts. Other things we've done. The key to our program, the biggest change at Water for People is we don't work with local NGOs at all. We only work with local private sector. Local NGOs, they think we're the market. We've actually developed a saying in Water for People that if someone loses a job because water stops flowing, that's a good thing. Right? So we've changed the incentives. It's all about job creation at local level. Last year in Blantyre alone, we've created 552 jobs, right? 485 of them are women. That's pretty good. Water's flowing better. Tariffs are being collected. Downtime's being reduced. So that's a good outcome for our $800,000 of investment of ourselves. We also have the areas we've worked in. No cholera in 2 years, and I know this is a health conference. That's a really dangerous place to go. I'm not going to attribute too much to that. I think we've done something around that, but I'm not naive enough to think that Water for People solved the cholera problem. Nope. But these were cholera-rich areas, and that's a good result. Also reported decreases in diarrhea. I lived in Africa for 20 years. I had diarrhea all the time. Never thought it was because of water and sanitation. Always thought it was food. But it's still an interesting outcome. Don't you agree? I mean, really, it's always food. We've also created 86 sanitation jobs, or we've created the environment for 86 sanitation jobs, so there's money moving, jobs being created, and all of that. There are 87 villages now that have become open defecation free. Every family has a toilet, including families with people with disabilities. Including families of orphan kids. There's no family in these villages that don't have a latrine, and we've tested it. Not only do you have a latrine, but we look at the quality of the latrine in terms of hygiene, so is there poo and wee on the floor or on the walls, and we also check if there's poo in the environment. So that's a pretty big result. That's pretty cool. We don't count this, but when we work in Blantyre, we started, and all the local committees had massive debt to the Blantyre Water Board. And so what we said is, can we set up private operators, right? So that's where the jobs have come from. We'll call it a water user association because nobody likes private. Nobody likes the idea that they're making money, but it is basically that. And don't forgive their loans or their arrears, but turn the water back on and let's come up with a tariff and a system that works so they can repay it. So since this program started, not one of the water user associations, there's 9, and we're building it out to the other 10 slums of Blantyre. They've paid off all of their arrears. They owe nothing, and that's $77,000 that they've paid off. We don't calculate that in the money, but that's a pretty good result. Last thing real quickly on this is they actually have collected in revenue over $440,000. That's partially to pay for these staff, but they've used that actually to invest and improve in the water system, extend services without any of us. We've also seen over 7,000 latrines in Blantyre be built with not a single drop of subsidy. We've unleashed loan capital into that through banks with no guarantees from us. Okay, so those are pretty good results. In the water sector, most people don't talk about that stuff, but those are pretty good results. What we also did, if you remember, we talked about moving money. We basically sat back and looked at all the money that started to move as a result of our investments from different donors, from different agencies who are now investing in the areas we're working with because they trust the departments of finance. So they're literally putting their money in the way that we have set it up. The value of that is $2.8 million in a year. So what we're trying to show is that if we can change the debate on overhead, that we put in $800,000, we generated all these results that are good. We have huge challenges, so we've got to keep going. But $2.8 million moved. That's over 3 times the investment. So are you good with that? I think that's a different discussion. So we're going to take on Charity Navigator this year a little bit, and I hope you'll join us in that. And we do it again from a bit of a position of strength. So Water for People is quite intrigued by the growth of Everyone Forever. I think it has huge promise. I think it'll be called other things. I think others will add things. We're trying to avoid the mistake of PRA. Do people even remember, do people know participatory rural appraisal? It's kind of a methodology. It was very popular in the 70s and 80s. It became really loose and flexible and anyone could do it, and it really got diluted. So we're trying to hold the core principles of Everyone Forever, draw people in to it, make it a movement that transcends us, and hopefully lead to the systematic change that social entrepreneurism promises. Does that make sense? Cool. Well, thank you very much. That was right on time. So we have a bunch of microphones, and if you think I'm talking complete garbage, hit it. And if you have any questions, I'm really happy with that too. And anything you can suggest that we should be thinking about would be deeply valued. And I think we have about 20 minutes for questions. Nobody ever wants to be first. Thank you. I'm going to just grab my water. Please introduce yourself, yes?
First of all, thank you. This was very inspiring. I'm wondering if you could say a little bit more about the climate change impact and how that figures into this whole movement that you,
Great.
You know.
Can I just, could you tell me who you are?
My name is Deb Arts. I'm with Icon Global Learning.
Ah, fantastic. Deb?
Deb.
Thank you. Yeah, no, it's a great question. So everywhere we work, we're seeing rainfall patterns change. We work in parts of West Bengal that might be underwater in 15 years. We work in really semi-arid areas. We're seeing everybody is looking at, so in Bolivia, which I talked about a little bit, everybody's looking at the Andes and talking about how it's receding. And you know, you see moms kind of looking up there kind of anxiously. They get it. What we're seeing is radically different rainfall patterns. So we're seeing harder rains over a shorter period of time that is not replenishing aquifers. And combined with that, the kind of pounding aquifers are actually taking from increased population, increased demand, and productive and agricultural purposes. So we're doing a lot of work right now on replenishment, on storage, on conservation. The biggest intervention we've had in Latin America, frankly, has been the introduction of meters and linking those to tariffs. So a lot of gravity-fed schemes, I don't know if people know, but gravity-fed schemes are basically you take water from a spring up in the mountains and you drive the water down through pipes and then it comes out of taps. For many, many years in Latin America, if you metered that, like we do in the United States, it was seen as the intro to privatization. Bechtel was coming, oh my God, we got to stop this. We've actually turned it around on a conservation argument and a payment effort. So we found that everyone wasn't being covered when there were no meters because everyone closer to the system took all the water. But then when you linked consumption with a tariff, then we saw it reaching everyone. And so people are defending that. But I think it's a huge challenge. It's a huge challenge, and we have not even remotely figured it out, and it's the biggest factor across our countries that we're most worried about. Yeah.
Hi, my name is Jill Ratner. I'm a pediatrician. I work in Haiti, in rural Haiti, with Hands Up for Haiti. Thank you for the wonderful talk.
Thanks.
My question is, working with the Ministry of Finance in some of these countries, I'm very intimidated, as I think most social entrepreneurs are, by working with the government on a national level, whereas you might be able to work with them on a very rural or a local level fairly easily. It's pretty intimidating to look at these governments that are unstable. And how did you manage to cross that barrier and feel safe in some of the places you discussed?
You know, it's a beautiful question. Thanks. It's Jill?
Yes.
Thanks very much. That's a great question. So we're modelers, right? That's what we do. We think that if you can show something, then people can sit back and go, ooh, I get it. So for us was to get it one time. And then all our other country programs could see that. It also was very important to hire the right staff. So since I joined, we only have one person who was running a country program that was there when I joined. We've seen a massive transformation of staff to try to do this more ambitional program. And it's nothing against those people. They just didn't want to do it. And so we have recruited people who are a little less intimidated to go. That said, my hat's off to you for working in Haiti. I think Everyone Forever actually does not work everywhere. I think it will not work in South Sudan. I think it will not work in Somalia. I don't think it works in Haiti. I think that what instead we can do, and again, I get this a little bit from polio, is that you don't go to the hardest places first. You go to you go to hard places. I mean, Bihar is brutal, but there is an institutional structure in Bihar to do that. There's massive caste problems that we have to overcome because for us, those are the everyones, is once we can get to Dalit communities and government is actually servicing Dalit communities, which they don't want to, that's when we know we've done really well there. But we think that if we can tip Rwanda, for instance, if Rwanda can go in this direction, then Uganda is going to come, Tanzania is going to come and all that. Someday South Sudan might come. And we would love that to happen. And so the question really is, what do you do with South Sudan between now and then? And that's for better people than me to figure out. But hats off for Haiti, seriously.
Hi, I'm Paige Kirkpatrick. I'm a student at the University of Minnesota, MHA, nice. MBA. I have a couple questions, actually. Great. The first is you were talking about the numbers and the impact, your overhead, your cost lump sum. Was that specific to one area, and combining that with the discussion you had fighting the excitement that people have for funding philanthropy versus wanting to see results? How long, does it take to scale it up to that level if it is just one area? That's my first question.
What's your second question?
My second question is how do you create and generate an ownership in the community? So you talked about connecting with the Ministry of Finance, you connect with the government, but if something's going to be sustaining in a community, you really want them to have ownership.
Fabulous question. So let me do the second one first. We have found, particularly on the water side, not so much on the sanitation side, but on the water side, the fact that government and communities are putting in money and it's becoming more and more, our name isn't around, which is good. So you go to these places, it's really interesting. Nobody talks about water for people. Our logo's nowhere. And Government, mayors will say, this is my program, this is what I'm doing, and communities will say, this is our system because we paid for it. So I think that's a really big issue for us. I think also because of the jobs, the job creation that's gone on across the globe, the people with jobs are looking at you as their customer. They're not looking at me, the NGO, as the customer. And that's a really big difference. And that's one of the main reasons we got away from NGOs, local NGOs. And I worked for local NGOs for 15 years, so I have a soft spot for local NGOs. But local NGOs look at the donor or the NGO or whatever as a customer, and we've tried to refocus people there. So through that, there's greater ownership, I think. If you want to come and evaluate it, that would be great. But I'm pretty sure that's true.
Well, and
they feel it's theirs.
And speaking, you mentioned models. How do you, if you do have failure, you were saying, get it right once. How do you overcome that so that people do want ownership of that project too?
So again, when you're looking at scale, failure isn't just, okay, that village, their water went down. The question is, why did the response mechanisms that were put in place respond to the problem? Typically at, oh, that broke. You're looking at, why did the private sector guy not fix it? What do we need to do there? So it's a little indirect. Does that make sense?
Yep.
Your first question is, we're looking at this at 3 levels. So we're looking at a country level. So we've got 10 countries. We're going to have that kind of analysis at 10 country level. And it's all the work they're doing and the spread that's happening because of it. Then we're going to roll it up to regional level. So here's what's happening in Africa, here's what's happening in Central America, here's what's happening in South America, here's what's happening in India, and then we're going to roll it up globally. And I'm interested in that global number because I think, there's some places, India, Bolivia, Honduras, Rwanda, where we're now minority investors. And so I think you're going to see this number grow quite dramatically. And again, I think it's a different discussion, so I want to have that discussion. Thanks for your question.
Thank you.
Hi, this is a great talk and really made me think. I'm Travis Tennyson. I'm the Executive Director for Servodia USA. And my question was sort of similar to Paige's. I was thinking about dependency and I was thinking about responsibility. Yep. And her question kind of covered the dependency part, and I think you spoke to that really well. And but the responsibility part, I wonder if you could talk about a little bit more, and particularly in terms of monitoring. So your organization's making a commitment. Your catchphrase is everything, everyone forever. Yep. Right, which is a long time.
Forever isn't 10 years.
Yeah. So I thought.
It's a great question.
Yeah. So I was just thinking about how water systems in other places in the world developed, and who's going to feel ownership and pride and responsibility 30, 40, 50 years from now, and how you talk about that with your donors, and how you think about that as staff people, and how you communicate that to the communities that you're working with.
That's a lovely question. We don't communicate it to the communities. We are very indirect in that sense. So again, communities don't really know we're around, which is good. So in Bolivia, there's this district called Orani, and the mayor of Orani is one of these hugely ambitious guys. 2 cell phones. He's about 30 years old. He says, I don't have time for women. I got to solve these problems. He has the ear of the president. I mean, he's really a remarkable guy. He came up with this. He loved the monitoring. Once you create the environment where monitoring makes sense in terms of response as opposed to just data. So not afraid of bad things. There's a response. What are we going to do about it? Then they start to see that, wow, this is pretty cool. So what he did this great program where he had everyone in the entire district, every family, every school, and every clinic, if they had a tap in their yard that was working, they paint a blue water drop on their house, right? So you can drive down the road, you see these water drops. If you don't have water, you don't put it on your house, and if the water stops, you cover it up or you scratch it off, right? And so what's happened is that he goes into villages and literally says, he knows just like polio, right? He knows exactly how many people in his district don't have water because he'll go to a village and say, how many houses don't have drops? I was with him about 6 months ago. We were in a village where 3 families didn't have drops. So and the reason was one was above the system, which is a technical problem. One had just moved into the area and didn't trust the community, which was fascinating. And the other one had just lost the husband and couldn't pay. Right? So 3 very different problems. They've now solved 2 of them, not the woman above the system, because that's going to require a little more technical work. But they basically offered free water to that family, cross-subsidized by the rest, so that's where they feel responsibility for that family. And the new person, they used it as a gauge to see if the community was really trustworthy, which was good. So our goal, we're basically saying, and I really appreciate you asking that, we're saying we're going to give you 10 years of monitoring. Our goal is actually to embed it and to be doing it at all, and to create the environment for this to happen. So what that means is in a couple countries, particularly Honduras, we've kept doing the results monitoring we look at, looking at the indicators, but we've actually supported government to adopt their monitoring system and apply it. And the monitoring is actually part of the bragging that's going on. I don't have an answer for whether this will work in 30 years, but I think it's trying to get there, and we're going to be talking about the steps along the way, again, particularly on finance and on water resources, about are we comfortable now, like there's enough money to replace all the systems, so at least there's enough money, and then we'll see if they do it.
Thank you.
Does that make sense?
Yeah.
It's a really great question, and it's not easy. I love monitoring. That's my real passion. But it doesn't work if we're the only ones monitoring. I think we're just modeling it. We're creating the space for people to be comfortable with bad news. We're showing that it's about response, and then we're backing out.
Yeah,
and it's at different stages and different.
Really cool. Thank you.
Thank you.
Hi, I'm Mike Toole at Bucknell University, and I teach engineering.
Where?
Bucknell.
Oh, Bucknell,
small
fabulous.
School in Pennsylvania.
Yeah.
So, more people.
Sure. And to join organizations and use it as a learning opportunity as opposed to a doing opportunity. Does that make sense?
That makes sense. Great, thank you.
Great. Yes, sir.
Hi, my name is Brad Kerner. I work at Save the Children.
Oh, fabulous.
It's down the road in Westport, Connecticut.
Oh, great.
So
We love you guys.
it's a very inspiring talk, so thank you. I'm fired up about your blowing up of Charity Navigator ratings.
Yes. Are you going to join us?
Maybe personally I can.
Okay, that's good. I'll take one.
Talk to our CEO.
Every organization needs one commander, you know, digging in there. I like it.
So I love the idea of doing a rating based on return on investment, and I think it works really nicely for a very focused organization like your own.
Yes.
But how do you think that would work for us mega organizations like Save the Children?
So yeah, no, I'm having this conversation actually with Catholic Relief and Care. I'm happy to have it with you guys too,
Okay, yeah.
frankly. So what we're suggesting is, as an initial step, to segment by your focus areas, because that's where you can do it. So Catholic Relief, Care, they have very strong water programs. So do it there first, and say our water return on investment in terms of programmatic impact and in terms of moving money and getting things going is this. And then do it in health, do it in ag, and all of that. I'm also working with the CEO of Plan International. She's thinking through this with your question, because it is easier for us, much easier. But I think they all think that if they can get it almost departmentally or sectorally, then you can roll it up. You can roll it up into something bigger. And please, Save the Children, again, you guys, Care, CRS, World Vision, and Plan, the minute you guys add your value, you'll come up with ideas we don't have, and we all get behind this, we'll change this discussion, which would be huge.
Yeah, great, thank you.
Yeah, thank you. Yes, sir.
Hi, my name is John Paccione. I'm a faculty member at the School of Public Health, University of Albany.
Oh.
And I'm teaching water quality and public health next semester. So
nice.
Wait till the students see the course.
Yeah, send me the curriculum. I want to see that.
You know, but what we don't have, just to begin with, the United States really has a very different procedure for implementing water quality. It starts at the federal level in our country from the EPA.
Yes.
And then it trickles down to the states, and then from the states to the counties, and from the counties to the towns.
That's right.
And it's mandated by law. Safe Drinking Water Act 1974, so on and so forth.
Yep.
But this is different. It sounds to me like there's money available for these things. They may even have some standards in place.
Yes,
I don't know if they do or not.
They do. They're not enforced, but they do.
So how do you position yourself, and how do you approach a government and say, we'd like to help you, and we think we can? Do you hold yourself as a consulting firm?
Yes.
Or so that's how you're doing it?
A little bit. I mean, it comes off that way a little bit. But we basically say, again, because we put some skin in the game, and because technically we're very strong, we're quite strong technically, we basically say to country governments that we work with at national level, you sort of want to do this. And they do. They want full coverage. They want to be NGO independent. They want to have their regulations and policies applied. They want the problems with those policies and regulations to be addressed and changed. But nobody helps them do that, to be honest. People go in and they do their little projects here and they kind of bypass government often and all that kind of stuff. So we say to them, let's try it out. The risk, we'll take the risk in the beginning. We'll put in most of the money. You know, we'll get it going. But we'll put in most of the money, we'll take the risk, and if it doesn't work, you can blame us, right? You can blame us. So what do you think they do? They send us to the worst district, farthest away. I mean, we are in the middle of nowhere in some countries. It's like, nobody in the world's going to come see this. So we basically say, yeah, we'll work there, and we do. We'll work in those really hard places, but we always say, as kind of the deal, why don't we do a couple closer to the capital, because if it does work, you're going to want to see it. The biggest problem with water quality is, again, the response issue. So every country has water quality regulations. Many countries actually have water quality people. It's usually pretty under-resourced and they're kind of holed up in a funny building. But it doesn't happen because when you do water quality analysis, you have to do something with the results, right? And they're scary. Sometimes they're scary. We were in Honduras recently, and national government called us in, and they know that we do arsenic mitigation in India. And they basically said, I think we have arsenic in this area, can you come and let us know? And sure enough, they do. So we brought in some technical people, we did the analysis, and the entire conversation was around how do you build up your water quality ability to be able to test this in other areas, and what are you going to do about it, and how are you going to communicate it? And that's really hard, because now the government has to, now they know that they have an arsenic problem. They have to do something about it. And so it's really creating an environment where it's good to know bad information, it's okay if you do something about it, and be comfortable trying things in that. And that's not easy. Does that make sense?
Well, it makes a lot of sense, but a government you can see a government can get very defensive. What
right
does it matter?
away.
We're not doing a good job.
Yep.
And as soon as you elucidate the fact that they have problems, they can become even more defensive and start trying to cover up those problems that exist. Yes. Everyone knows they got a problem. They know they've got a problem.
Yes.
So from a people skill perspective, how do you pose yourself? We're not going to come in here and we're not do-gooders. We're really going to do something good for you, but we're more like a consulting firm. Is that
I mean, we come in and we basically say, you're trying to solve this problem, so let's try to solve the problem. We also are tying into what I said a little bit about the democratization process. So at local level, people are aware of the problems and they'll change it out. So there is a little bit of a different incentive now for governments to at least hear that, which I think is good. The third is, again, it takes some time. It really does take some time, because you're exactly right. The initial reaction is negativity, is defensiveness. What we have found is the best way to start is to blame ourselves first. So we often will sit there and go, God, we messed that up so badly, and oh, we thought this would happen and it didn't, and what were we thinking, and all that kind of stuff. And when they say that we're criticizing ourselves, then you see these little cracks open where they kind of go, okay, let me try that. And then when we go, yeah, no, that's okay, what do you want to do about it? So it's a people skill, like you said, and that's not an easy people skill. The other thing, just real quickly, the one thing, we do this thing called reimagining reporting. We are trying to blow up reporting as well. That's another talk. Well, it's actually very simple, right? So we went around the world and asked people, how do you learn? And they didn't say, I was shocked, they didn't say they learned by reading 60-page reports. I couldn't believe that. So we're using visualization and technology and colors and all that kind of stuff to report and storytelling, video. But what's interesting is we do these things called reimagining reporting sessions, where we have all of our partners and staff sit down together, and frankly, I go to almost all of them. And I sit there as CEO, and I'm not trying to wear a big hat, but I go as CEO and I show that I'm comfortable with criticisms of ourselves, and then I'll hold that space. And then again, they start to see that change. It's not easy. It's really not easy, and I'm not sure how scalable it is.
So do you ever set up companies, set up a small water company and say, this is going to be a water company? Mm-hmm. And in the process of doing it, you fill out the paperwork, you get the licensing from the government. you start employing somebody. Where does that initial capital input come from?
So the water user associations I was talking about in Blantyre are exactly that. They're mini utilities. They're basically mini private operators who get bulk supplies from the Blantyre Water Board, and once it comes into their slum, they're responsible for it. They're run as a business and all of that. What we have done is that's part of where our philanthropic money goes. It goes to help set up those. They don't work for us. They're independent. They also have to put some skin in the game. We're increasingly getting banks to make those loans because they can start to see that it worked there, it worked there, it worked there, so it's not so bad. But yeah, that's how we use some of our capital. And there are not many donors who are comfortable with that, to be honest. That's too risky. And it's not only too risky, but it's also, there's still this funny dance with a lot of donors between, well, that's private. And we're like, yeah, it's private.
This is impressive. I think the students, because we attract a fair number of international students.
Great.
And one of the concerns we've had over the years is how do we develop the course and continue to morph the course so that it is more relevant to some of these students from other nations. And I think that this is a very interesting procedure or methodology or philosophy. So very good. Thank you.
I appreciate it. That's very kind of you. Thanks very much. Hello.
Hi, Ned. Thank you for the time and the talk. My name is Thrasingham. I work with a international development agency in DC called Results for Development Institute.
Called what?
It's called Results for Development Institute. It's a small NGO, and I also
like results.
Coordinate a small NGO in Sri Lanka doing solar lamp distribution.
Oh, great.
So my question is, we're on a project right now with a large foundation. I won't mention the name.
Yeah, please don't.
Yes, where I took on the project with some trepidation, but I'm asking for your advice. It's in the sanitation space, and they've taken a technology-driven approach to the problem, which we were uncomfortable with, but we thought we could play a role in helping open their eyes. So we're focused on India, and we're serving as informal advisors for their India strategy.
Nice.
We're trying to convince them, based on the conversations that we've had in India, that the technologies that they've spent 8 figures worth of money investing in, the Indians don't really want it. They don't see how it fits. It's not commercially feasible. Technically, there's questions. It's a message the foundation doesn't want to hear. So 2 questions. One, within...
Get a new foundation.
Well, yes, that is next. That is immediately on the list. As soon as the contract ends and we can get out of it. But one, what's your view of technology-driven solutions? I think I have a sense. Second, when you have an entity that's so focused on it, and they haven't focused on the community first, is there any hope for the investments that they've already made? Or our instinct is a little bit, maybe they have to start from scratch.
Great questions. Those are great questions. So actually, I'm more of a sanitation guy than a water guy. I moved to Denver, and the first thing I did was build a composting latrine, and was told by the head of Denver Water that it was completely illegal. But then he said, it's okay, keep it. My poor kids, they're friends.
They go in the composting latrine?
Yeah. I mean, my kids bring friends home. They don't bring friends home anymore. It's sad. They think our house is uncool, and it's partially because of my toilets. The thing we've done with sanitation, which I didn't talk about, is we changed the discussion again. So I'm a Bama fan, by the way. I'm still in mourning, just letting you know. So cell phones basically figured this out. Verizon couldn't care less that I have an iPhone or an Android. They don't care. They don't care. They want that ongoing service. They want me to pay that ridiculous fee every month that I can't break, right? And so the sanitation sector has spent too much time on the phone, on the toilet, and they haven't figured out the service. And so we have spent a lot of time, in those 86 sanitation jobs in Malawi are all desludgers. There are people who go to your house and basically clean out your toilet for a fee. So there's a bunch of these around now that are really good. Let me just talk about one. So Sanergy in Kenya. I'm the chair of their board. I have to disclose that, but I really love them. They've figured this out. So basically they go and they've franchised the toilets out. So you take a toilet in a slum and you charge a fee for use, right? And every day someone from Sanergy will come and they'll take away the poo, they'll take away the wee, they bring it to a central place, they process it, and they sell it. Or they're on the verge of selling it. They haven't sold it yet. And that fee costs $100 a year, right? And so what they're focused on, what we're focused on, another group in Ghana, Clean Team, spectacular, they're trying to figure out what is that service, because then the toilet is a different question, right? Then it's like, I'll get you a toilet. Maybe it's with a loan, maybe I'll even give it to you, not me, Water for People, but me, the entrepreneur. I'll give you a toilet, but you're going to pay me for cleaning it all the time. And once you do that, the entire conversation on technology changes, because it's really about what technologies actually are most facilitative of business. So the big thing in the sanitation space, as you know, is Gates, right? Gates did the reinventing the toilet thing, and a lot of people are screaming, oh, these are too high tech and blah, blah, blah. They're missing the point entirely. What's fascinating about the Gates toilets is there are components in there that are brilliant. There are pieces of this one and pieces of that one and pieces of that we want. We really want those. And so what Gates is trying, and Gates gets that, to his credit. So what they're now doing is they're trying to they're navigating, patent issues and all this stuff, because people, again, it's that ownership issue that I was talking about, right? This is my toilet. Well, okay, then you can sell 5 of them, congratulations, go to hell. Or you can say, actually, I will deconstruct this toilet and make these components available, because then that will transform the sector. And it's fascinating. It's a fascinating conversation, because a lot of the winners are universities and businesses who don't like doing that. I don't care what you say.
Yes. Yeah.
So I think the thing is, it shouldn't be technologically driven. It should be focused on service, thinking about service over time. And the question then really becomes, how do you build businesses and an environment around that so that those businesses can thrive?
Interesting.
Does that make sense?
Yeah, that's great. Thank you.
Thank you.
Thank you so much. That's all the time that we have for questions. Please join me in thanking Ned Breslin for his phenomenal presentation.